Clinicians can be driven to work in MS for very personal reasons. Carrie Samarco, a nurse practitioner, discusses what motivated her to work with patients living with MS. Carrie talks about the importance of the MS team, not only from her perspective, but for the better management of patients living with the disease.
Hello, I'm Carrie Samarco, and I'm a nurse practitioner, and I work with people living with multiple sclerosis. And I wanted to talk a little bit about my journey as an MS nurse and what that's looked like in terms of the people that I've crossed paths with who have helped me to get to the point where I am now. So my journey began many years ago when I was in nursing school, and one of my cousins was diagnosed with ALS, Lou Gehrig's disease, and he was a very young man at the time. He was 29, and I wanted to learn more about ALS and kind of understand a little bit about what he was going through and what he would have to contend with. And I was fortunate enough that at the time, a good family friend who was a physical therapist knew someone named June Halper, and I had known nothing about June. All I knew was that I was a nursing student who was lucky enough to get a placement at a hospital in Teaneck, New Jersey, Holy Name Hospital, and to be able to work with a team of people who worked with people with multiple sclerosis. And actually one of the physicians there had worked with patients with ALS, and that was really kind of the in that I had had. And I didn't, quite frankly, know much about multiple sclerosis at the time. And my real focus and interest was in learning about what my cousin Ricky was going through. And at the time I was introduced to June, I started to see patients with MS and see how the team interacted with these individuals, and medicines were coming out around then, and I just looked at these young people in their 20s and 30s and 40s who were being diagnosed with MS and how their life journeys were just kind of upended, right? They just, here they are, they're graduating from school, they're getting their first job, they're getting married, they're having their first baby, all of these amazing, first-time things that are going on in a young person's life. And here they are now having to fit this puzzle piece of MS into their lives. And I thought, this is an environment that I want to be in and learn about and work with people who are contending with this journey that they're embarking on, young people being diagnosed with MS. And interestingly, one of the things that I was first kind of charged with doing when I was spending some time as a student with June was there was a new study going on for sildenafil. And they were looking at individuals who had spinal cord injury, whether traumatic or organic, so MS was included in that. The fact that at such a young age and as a student I was involved in nursing research and research in general was huge and really impacted me on my journey. I interviewed at Cornell at the MS Center there with Dr. Brian Apatow, who was then the director, and he gave me my first job at the MS Center, and I am so grateful for the experiences that I had learning with Brian and working on clinical research and seeing patients with him and learning about the medications and reviewing MRIs up on the light board together and just everything that he really graciously shared with me. There weren't other nurses at the center. There wasn't another nurse or nurse practitioner for me to learn from a nursing perspective, so I was fortunate to have someone who was willing to share their knowledge with me. And I realized then, after spending several years working at the MS Center, that I wanted to delve into MS more, because as a student in undergrad and in grad school, I I don't know about other people, but we didn't spend a lot of time on multiple sclerosis. It was a paragraph in a chapter and, part of a lecture, but everything I learned was on the job, so I'm so grateful for the actual hands-on experiences that I had. But I decided I wanted more. I wanted to really study more, and that's when I went back for my doctorate in nursing practice. And when I was up at Columbia doing my doctorate, I was afforded an amazing opportunity to do my residency at the Multiple Sclerosis Center there at Columbia with Jen Smirka and Mark Tallman. And I was so grateful to be able to step into the role of being student and being able to ask questions and not expected to know, right? But to be able to, even though I had years of clinical experience in MS, to be able to really step back and approach it in a different way. And it was a tremendous experience, a wonderful learning experience. And again, here are more people that, as I'm on my journey, are really helping to shape me and allowing me to have this dynamic experience. And in addition to my residency experience with Jen and Mark and my working experience with Brian, working in the New York City area, we are so lucky in a way that we have this concentration of multiple sclerosis centers, because these MS centers are staffed with these amazing multidisciplinary teams. And in a very small area, I was able to connect with nurses and nurse practitioners who had devoted their careers to MS. And we formed this coalition in the New York City area where we were able to sit down and get support to draft best practices papers, and even just the ability to be able to reach out, send a text, an email, a phone call to say, so what are you guys doing with your drug protocol for drug X? Or I have a patient who lives in this area of the city and I need a really great physical therapist. They're not able to come into the center. Just to be able to reach out without any kind of competition. So it was just so natural to ask questions and to surround yourself with these spectacular people, and we're all learning together, and some of us were, had maybe less experience or more experience in different aspects of caring for people with multiple sclerosis. Not just my nursing colleagues, but when I look at my multidisciplinary team at NYU and what I've learned from my social work colleagues and my occupational therapy colleagues and psychology and psychiatry and my research team and the urologist, and am I forgetting anyone? I mean, it's just, it can be overwhelming to be surrounded with such passion and expertise, and I feel as though every time I walk into a room, I try to say, what would the social worker do, right? What would the occupational therapist say here? How would the psychiatrist maybe address this? And to kind of sometimes take off those disciplinary blinders that we have in a profession and look at it, the situation from a different perspective, look at this human being as a holistic person. So after I finished my doctorate and my time that I had spent with Jen and Mark, I was very fortunate to be awarded the John Distal Fellowship in Nursing. And at that time, one of my dear friends and colleagues, Eliza Ben Zachariah, who's a nurse practitioner, and she was working at Mount Sinai at the time, she became my mentor for the fellowship program. And we had decided to look at the role of nurse practitioners in MS centers around the country. And we had developed an observational tool and an online survey to really try to understand, what does the role look like? We know about, ideally, textbook, what the role of the nurse practitioner should look like, or, what we all wish it might look like. But we really wanted to understand, what did MS NPs roles look like in a variety of centers around the country. And really, time and time again, what we were hearing back is like the clinical role was critically important to these women and men who were serving as MS nurse practitioners. It was just a really interesting exploration in what the role of the MS nurse practitioner looked like in the U.S. Another project that was born from the role of the MS nurse practitioner fellowship was a handbook on MS for nurse practitioners. And this was generously funded by the National MS Society, and Rosalind Kalb spearheaded this and worked with myself and Diana Logan and Gina Remington to develop an online and handheld book that really wasn't for MS nurse practitioner specialists as much as it was for nurse practitioners who come in contact with our patients every day in primary care and in maternity and in endocrinology and post-op, and kind of a quick go-to reference for them to learn about MS, because remember what I said, most of us in training, whether it was undergrad or grad school, there wasn't a lot of focus on MS. So these kinds of projects, to be able to work with really amazing men and women in the MS field to create educational material for individuals who are hopefully eager to learn about MS, was incredibly empowering and really exciting. And it was several years ago, probably in 2007 or 8, when an article was published on mindfulness-based stress reduction and its impact on certain symptomatology in multiple sclerosis. And I remember sitting down with a couple of my colleagues, Tamar Kalina and Lisa Lang, and we were like, how do we get our hands on this mindfulness thing? Like, what is this? You know, now everybody knows what mindfulness is. But at that point, it was something that we weren't really familiar with. But what we knew was that we wanted to improve the quality of life of people living with multiple sclerosis. And symptom management was critical, and we have these spectacular disease-modifying therapies that can really make a significant impact on multiple sclerosis. But in terms of symptom management, we know that there's still so much that we can do, and it's not always about taking another pill, right? So we wanted to offer something, if it were possible, to our patients to help in managing some of their other symptoms. And my director at the time, Dr. Joseph Herbert, was so incredibly supportive and just said, run with this. You know, what do you want to do? And I took a course, an 8-week course, and we bought textbooks, and another colleague of mine was trained, and I carved out time during our clinical week to meet with a group of patients for an hour on Wednesdays, and we still do it now all these years later, and it's our mindfulness group, and it is just an amazing support group for patients who we just talk about stress is a reality of life, and we all have ways of coping, and some are more productive and some are less productive, and let's just expose ourselves to more productive or healthful ways of coping. And it's interesting because multiple sclerosis so often doesn't even come up in group, because it's just about life, and it's just about sitting around as a group of people who are trying to support one another to be our best selves. But I couldn't have done that, and we couldn't have offered it to our patients if we didn't have the support from above. And yet from that, then, my nursing team and colleagues and I, we were able to actually do nursing research on mindfulness from this program. And then that led to us saying, you know, what we do with our patients is really, really important. The interventions, the nursing interventions that we employ, that we come up with, really can make an impact and a difference. And we developed a protocol for one of the new drugs at the time for side effect management. And we looked at it in a structured way, and we got research funding for it. And we ended up creating posters from that and papers from that and presenting on that. And that was purely nursing driven. And that was done because we had support from our director who said, what you do is critically important to the team and for our patients, and I support you. And everything that I'm sharing with you is because I recognize that where I am and all the amazing things that I have and I've learned in my journey and working with people with MS is about my hard work, but just as importantly, it's about all of these amazing people that I've crossed paths with over the year and who are still in my life and still supporting me, and I'm supporting them, and we're making a difference for one another. And ultimately, the end goal is that we make a difference for people who are living with multiple sclerosis. So thank you for letting me share my journey with you.